Hello guys, what's up? This is Dr. Rob with physiOlogix Sports Physical Therapy of Miami. Today I wanted to go over a little bit about some exercises that you can do when you have acute low back pain. You know, you wake up in the morning after maybe a leg day or a low back day and you notice that all of a sudden your back is so stiff you can't move it, or you feel so stiff that you can move, you can get out of bed, but you're walking like a zombie the whole time and it's miserable, okay? So what I'm going to go over with you today are just some simple exercises you can do probably from your bed or from the gym if you want to go to the gym and just keep that routine going. So let's get it started. So the first one we're going to do is real simple. You're going to lay on your back and you're going to feel your pelvis, right? You're going to put your hands right on these anterior superior iliac spines right here, these little bumps, those bumps that you see really fit, thin people have. And you're gonna feel those bumps move towards your face. So by squeezing your butt and rounding your low back, you're gonna bring your butt off the table just a little bit, and then you're gonna come back the opposite way and bring those bumps forward, okay? So those bumps are going to move towards you and away from you in a rocking motion, forward and back. Your back is gonna flatten when it comes towards you, and your back's gonna arch off the table when you pull away. So you're gonna feel that arch and rounding, just like that, okay? So you can do these for about 15 to 25 reps, 2 or 3 sets. Already you should feel your back start to loosen up just a little bit. And this is all done in the sagittal plane, the plane that's straight up and down from your nose to your crotch, okay? So that's this movement, we're loosening up just a little bit. We're getting that neurological override of you working that motion, okay? The second one I'm gonna have you try is we're starting to incorporate some rotational movements. And this one is called bent knee fallouts. You've probably done these before. I just got a crack in my back doing that. So you're gonna come to the side, and then you're gonna come the other way. You're gonna feel a big stretch going from your back around your side as you come to the side right there. So every time you do this, you try to go another millimeter, right? Your hands can be to your side. If you're on the floor, you can have them to the side like this. But because I'm on the table, I'm keeping them here. So you're gonna roll out to the side again, and then the other way. I'm gonna keep that rotational movement going for about 15 times each side and feel all this stretch out and lengthen, okay? It's not supposed to be easy. It might be really tight, it might be frustrating. When you get to the end, you can try holding it for 3 to 5 seconds. Take a couple deep belly breaths and let that really stretch out, okay? So now we've incorporated some rotational movements. We started with the sagittal plane one. All right, so we're adding on little by little, okay? Now that we've gotten some of those movements done, we can start with the simple stretch. So you probably know this one, a Piriformis Stretch. It's not hard, it's not intense, but usually by loosening up some of the tissues of your pelvic and glute region, you can take some pressure off your low back if that really is what it is. I mean, you have fascial tightness, fascial connections that go from your glutes, piriformis, your pelvis, through your lumbopelvic area into your thoracic spine. So working on stuff above and below the area is gonna be really helpful for someone with a really stiff low back that you can't bend each way. So you're gonna pull this knee to your chest with the opposite knee bent as much as you can, and you're gonna hold that stretch for about 30 seconds, okay? Another option, if that one's too hard or if you want to mix it up, you can push down this way. A lot of muscles that externally rotate the hip, also from different positions of your hip, can internally rotate it or perform different functions. So by changing your position of your knee, pressing up or down, you can get a better or different stretch. So try that out. 30 seconds, you can do each way 3 to 4 times on each leg, okay? So now we're loosening some of that up. So what's right above that? Your thoracic spine, all right? So a good one for your thoracic spine you can do, usually people get a foam roller right here and they'll have just to lock their knee down. But since I'm trying to work with people that maybe have no equipment, let's try this. You're just gonna lay on your side with your hip over the top. Your hands are gonna be here, totally rotated on your shoulders, and then you're gonna open up, all right? As much as you can. See, I'm just getting cracks again. So if I'm getting cavitations or cracks in my back just from this, when you're feeling very stiff, this is a great way to get those muscles accustomed to the movement, to A word that I use for it is accommodation. You're basically teaching your body that this movement is not threatening, and rather it's healthy, and it can feel quite good. So you can do 10 to 15 reps each side, 3 to 4 times as well. You're just working your way through. Honestly, by this time you should be feeling a little better, so it might get easier and easier. Open up. Just like that, okay? Let those shoulders rotate, open, open, open. You're reaching your arm over the top, and you're rotating all the way so your back is basically flat. All right, so now your back might be loosening up even a little bit more. All right, the next one is going to be a simple stretch that I like to do with people if you're able to do this. This one might be one of those, or if you're too stiff, you can't. But once again, on your side like this, you're going to pull your knee to your chest, and you're going to bend your other leg and grab your foot. This is called a Pretzel Stretch, and it's a great one to do with people that are generally tight with chronic low back pain. But if you have acute low back pain, then this is a great way to get a stretch not only in your hip flexors on the down leg, but in the entire glute and low back region, crossing over on the left. And you're just going to try to get your back flat on the table, pull this knee down, and pull the back foot back. So your goal is to bring that right hip, in this situation, the right hip, as back as possible and the left hip as over as possible. And you'll feel the whole unit stretch. Your back will be feeling tightness across the top side, and your leg, your anterior leg, or the front of your thigh and the hip flexor region will be stretched on the right. So we're stretching a lot of those muscles that are responsible for making someone feel tight, right? The hip flexors originate on the anterior or front part of the spine, so that'll feel good to stretch them as well. So you can hold that 30 to 45 seconds, 2 or 3 times. On each side, you can do that stretch. All right, now the next one we're gonna do is get the glutes going a little bit, but in a face down or prone position. So as you lay down, we're gonna be right here, and you're just gonna start off by doing little butt squeezes. So tiny butt squeezes, it's gonna look funny. You can do this laying on your back as well, but I like this because now it gets us in a more extended position. It's basically making our back more accommodated to that prolonged extension while getting a little bit of glute contraction. So you can do both glutes, hold it 2 to 3 seconds, give me about 25 reps. Then you can do one glute at a time, so you're squeezing one butt cheek at a time. It's kind of silly, but it works because you're working individual fine motor muscles of each glute, getting things warmed up a little bit. Instead of just doing a gross contraction, you're getting fine motor working. Boom, right, left. All right, so now, after about 25 of those, give me some alternating hip extensions, okay? As much as you can. You might find out that at first it's not too easy, right? You can only go about this high, but take your time, get as much extension as possible, and alternate that. Your back feels a little tight, but you're still getting a lot of glute contraction. You'll feel a little bit of, it'll get easier over time, all right? Good, keep going. We're gonna get 25 each. Once again, another word for this is kind of graded exposure. You're slowly allowing yourself to go further and further by exposing yourself to motions that you couldn't necessarily tolerate before. All right? Now the last one we're gonna do, actually we got 2 more, but the last one in this sagittal plane that we're gonna do is putting your hands to your side and doing little mini press-ups, okay? You're gonna come down and then straight up. You're gonna let your back just hang, okay? Take some deep breaths and then come back down. If you feel like this really hurts or your back has a lot of pressure on it, then just come down, just do a little bit, all right? A little press, hold it, and come down. Give me a 5-second hold at the top. I'm going too quick, but I do everything quick. I talk too quick and everything too. So you're gonna come down, give me about 25 of those too, all right? And once again, you don't need to do this whole routine on your own every time. Just do what you can tolerate. Maybe get halfway through, maybe mix in some of these. But if you have 10 minutes, you can do all of them. And I bet you'll feel very different, okay? All right, here's the Master Pro one, right? This is the tough one. You're on the floor. Your arms are gonna be to the side. I'm gonna have you lift your leg up. I'm gonna put my arms here because it's the table. You're gonna lift your leg up and come around. Try to touch the floor with your opposite heel, all right? And come back down. They're called scorpions for the obvious reason, they look like a scorpion, but you're really trying to make a rainbow with that opposite heel. So I come up, and I draw a rainbow with that heel, and then come back. All right, up and around, and then back, okay? Up and around. You're gonna hold it, you're gonna try to draw a real nice rainbow. You're gonna feel that back stretch big time. Feels good to do a little bit of those prone press-ups afterwards. You might notice that it's easier to finish it off. But those are a few exercises you can do right away. If you have a tight low back, you wake up with a stiff low back, try these guys, work through them. You can do the sets and reps I recommended, or you could just do 2 or 3 sets of 15 each. You could do 1 set of 15 each, whatever you can tolerate. But these are some of my best exercises I use with patients who have that stiff low back following leg day, back day. Maybe they just worked really hard at the construction site. They're lifting patients all day as a nurse. Anything. You know what that's like, that acute low back pain. Check it out, try it, and tell me how it is. Let me know if it worked, which ones you liked, which ones you disliked, because a lot of people might need easier exercises than this, and that's something that we can address in the future too. Try these out if your back is very tight, and let me know how it goes. Thank you.